The Libido Doctor is in.
Hello and welcome. This is Dr. Suzanne. I wanted to take a minute to talk about pathology I've encountered a lot recently, and it's female genital mutilation. I've had a few patients who have come to the clinic to be seen because of that. Oh my God. What is that? If you don't know what I'm talking about, it is a custom in some countries where young girls, young teenagers get their clitoris cut. Oh my gosh, I don't even know how to express it, but Lord, I don't know. I believe it's extremely cruel. It should not happen. Those girls come and they see me, they are now 21 years old, and they tell me that when they were 11, 13, 15, 17, they got their clitoris cut. And it is so painful. And they explain to me that they have to lay on the bed, legs open, because any friction on the vulva is going to cause pain. But not just that. After a few years, they were given to marriage, and they report that intercourse is so painful, and the pain is deep. You know, we talk about dyspareunia. Dyspareunia is pain with intercourse, usually penetration. But these patients, they report that even the thought of having intercourse causes them pain. So I believe what they're having is a psychological dyspareunia, and they have a post-traumatic stress disorder, and they have such a rejection towards men that they actually need counseling. They have depression. All of them ran away from the marriage. For some reason, they found a way to leave the husband and find their ways here. And now they seek medical care for different kinds of things. Now, you need to know, after female genital mutilation, there are 4 different stages. We don't really need to go through that. What you need to remember is that they get the clitoris cut. And the people who do that are not medical doctor, is not under anesthesia. And it depends on the operator, right? Each one of them that I saw had different kinds of mutilation. It's not even uniform. Some of them, the labia minora were cut. Some of them, the suture was, oh my God. I don't know. I don't know what I would do without a clitoris. Without my clitoris, I don't know. But I believe that we need to raise the awareness about what those little girls are going through and just stop that. It's not humane. It's not. Now, I was talking to one of them, and I was asking her how, she does with intercourse. And she was like, I do not enjoy that. I have no sensations, and I just don't even want the guy to touch me. I told her that I could do the O shot. The O shot can actually regenerate the clitoris, because what those people don't know is that the clitoris, you see the head, at the top of the vulva, but it actually goes in. If you look at, I put a picture, it goes in to wrap the entrance of the vagina. So if we do the O shot, we can actually regenerate that clitoris, but we also have to do probably reopen the suture a little bit to allow the clitoris to come back out, depending on the degree of the cut and how it was closed back. It would definitely require some sort of plastic surgery to reconstruct that area, but definitely the O-shot can regenerate the clitoris. That's where we are. I just wanted to say a word about that. Now, the side effects of female genital mutilation are multiple. Not only on the vulva, right at that area, of course, the pain. Remember that the head of the clitoris is the most innervated area of the body. The pain is tremendous. Now, when they cut, because they don't have any understanding of the anatomy, they can also affect the exit of the urine, okay? Patients can have incontinence, they can have scarring, if they develop keloids, which is a hypertrophy, like the skin just hyper-develop. It can cause trouble in the way the urine is released. They can have pain. They can have vaginal infections. They can have, oh my God, so many things. But the worst is no sensation during intercourse. That anticipatory pain and anxiety, the depression, the post-traumatic stress disorder, the anxiety, it's too much. It's too much. And I've noticed something. It's as if those patients disconnect their vulva from the rest of their bodies. There was one I saw who was like, she wasn't taking care of herself because she disconnected herself from that area due to the pain. Another one had amnesia. She forgot everything that happened to her from the time she had that female genital mutilation up to, she erased from her memory probably 2 to 3 years of her life. And I was like, oh, Lord, we need to stop this. We need to stop that. Anyway, I don't even know if my talk was organized, but I just wanted to say something about female genital mutilation. You don't need to know all the stages, but the key is they cut those clitorises to prevent the girls from having sexual pleasure. For what? So they won't have, multiple boyfriends, or I don't understand. I don't know why that tradition is still going on. I'm probably very disorganized in how I'm telling you this, but it just breaks my heart. It's just too emotional for me to see what is being done to children and how it affects their lives as women. They're gonna be mothers one day. And I asked them, okay, do you have children? They said no. I said, but where you were sent to a marriage early, how did you manage? She said, I didn't want to have any child. I was like, okay. I understand. But look, we need to stop that. We need to stop that. We need to stop female genital mutilation. It's not pretty, it's not good, it serves no purpose, and it traumatizes these children. It's not acceptable. Okay? This was Dr. Suzanne, and I hope you will take this to the next level. Learn about it, advocate for these little girls, take action, do whatever you can. Me personally, I will offer free O-shots for these women when they are ready for that. That's what I promised my patients. I said, look, when you're ready, when you are in the place in your heart and your mind where you can envision a healthy relationship, come see me. And then the other thing I ask them to do is to forgive the people who did that to them and begin to learn to love themselves and love men. That's all I could do. Okay? Well, this was Dr. Suzanne. Thank you for watching. I'll see you next time. Bye.